Your heart, which is one of the most important organs in your body, may be in danger, which may put your life in a precarious position. You might be blown away to know that an estimated 20.5 million people, about the population of New York, died from cardiovascular disease in 2021. The most concerning aspect of heart disease is that it frequently presents itself subtly and with little to no warning until it reaches a critical stage. You may significantly lower your risk of heart-related complications by being aware of the early warning signs and responding appropriately and in a timely manner. In today's video, we have talked about 9 early signs of heart disease that you should keep a vigilant eye out for. If you are experiencing any of the symptoms explained in this video, it is important to discuss them with your healthcare provider. 1. Chest discomfort. Angina? Chest discomfort, often described as angina, is a hallmark sign of potential heart issues. The chest pain experienced in these situations is often described as tightness, pressure, heaviness, or discomfort in the chest area. It typically results from reduced blood flow to the heart muscle, usually due to narrowed or blocked coronary arteries. This discomfort arises when the heart is not receiving enough oxygen-rich blood, causing pain, pressure, or a burning sensation in the chest. There are 2 types of chest pain that heart patients mainly experience. Stable angina occurs when the heart's demand for oxygen exceeds the supply, typically during physical exertion or stress. However, unstable angina, a more serious symptom, occurs at rest or with minimal exertion and may be a sign of an impending heart attack. It might be beneficial to include foods that are high in omega-3 fatty acids in your diet. The connection between omega-3 fatty acids and healthy heart function has been the subject of investigation in a number of studies for 10 years, with a total of 45,637 different participants ranging in age from 18 to 97 years. It shows that EPA, DPA, DHA, and ALA were all linked to a reduced risk of fatal heart disease. However, the studies didn't find any associations between omega-3s and non-fatal heart attacks. 2. Shortness of breath. Heart diseases like congestive heart failure may lead to fluid retention in the lungs, pulmonary edema. The presence of this excess fluid in the lung tissue may disrupt the normal exchange of oxygen and carbon dioxide, making it difficult to breathe. Aside from that, heart disease may weaken the heart muscle or impair its ability to pump blood effectively. When the heart's pumping capacity is compromised, it may struggle to deliver enough oxygen-rich blood to meet the body's demands, especially during physical activity. This may result in shortness of breath, especially during exertion. To improve the condition, increasing potassium intake through foods like bananas may be helpful. Potassium helps regulate blood pressure and may counteract the sodium-related water retention that may strain the heart. A total of 16 different cohort studies came to the conclusion that a daily potassium consumption of 3,500 milligrams was associated with a 13% lower risk of stroke. 3. Fatigue. Unexplained fatigue, despite adequate rest, is another potential early warning sign of a weakened heart. In particular, coronary artery disease may narrow or block the coronary arteries, reducing blood flow to the heart muscle. When the heart muscle doesn't receive an adequate supply of nutrients, it may become less efficient at pumping blood, leading to fatigue. Also, to burn glucose and convert it to energy, our body needs a steady supply of oxygen. If you have a heart condition that causes your blood flow to decrease, you may experience fatigue or tiredness because the demand for oxygen is greater than the supply. Keep in mind that fatigue is a common symptom that may follow a stroke. For instance, a study on heart patients in the age group of 58 to 70 years found that stroke survivors had a high prevalence of fatigue and poor sleep quality. Even years after their stroke, 52% of the participants in that study reported feeling fatigued, and 64% said they had difficulty sleeping. 4. Irregular heartbeat, palpitations. Palpitations, or the sensation of irregular heartbeats, might be disconcerting. This symptom often occurs due to arrhythmias, when the electrical signals that tell the heart to beat don't work properly. The heart may beat too fast or too slowly, or the pattern of the heartbeat may be inconsistent. A heart arrhythmia may feel like a fluttering, pounding, or racing heartbeat. These issues may include abnormal electrical pathways, damaged heart tissue, or disruptions in the normal sequence of electrical signals. Conditions like mitral valve prolapse or aortic stenosis may affect the heart's valves, leading to irregular heart rhythms. Additionally, up to 50% of patients undergoing cardiothoracic surgery will experience arrhythmias at some point during their treatment. Increasing magnesium intake through foods like spinach, almonds, and avocados may help stabilize heart rhythms. In patients who had previously undergone heart surgery, taking magnesium in the form of a bolus dose of 60 millimoles was found to improve heart rhythm irregularities, according to the findings of a study. 5. Dizziness. Frequent episodes of dizziness or fainting could be an indication that blood flow to the brain is insufficient due to problems with the heart. These symptoms may occur when the heart is unable to pump blood effectively, which may cause a disruption in the delivery of oxygen to the brain. A slow or fast heartbeat may cause this, and it might be a sign that your heart's electrical system isn't firing in the right order. In addition to that, it might be an indication of a problem with one of the heart's valves. It is often of the utmost importance to drink enough water and maintain a healthy balance of electrolytes in the body. Potassium-rich foods, such as oranges and bananas, may assist in supporting the electrical function of the body. 6. Swelling in the legs, ankles, and feet. Swelling in the lower extremities is often due to fluid retention, which may be associated with heart problems. When the heart struggles to pump efficiently, fluid may accumulate in the legs, ankles, and feet. In addition to that, heart conditions may lead to increased pressure in the veins, especially in the lower extremities. This elevated pressure may force fluid out of the blood vessels and into the surrounding tissues, resulting in leg swelling. Consuming a low-sodium diet, which includes minimizing processed foods, may help manage this symptom. An analysis of 36 research reports found that individuals who consume a high amount of dietary sodium, salt, have a significantly higher risk of cardiovascular disease when compared to those who have a low sodium intake. This increased risk was found to be as high as 19%. It has also been shown that the risk of cardiovascular disease goes up by a corresponding 6% every time there is a 1 gram increase in sodium intake. 7. Nausea and indigestion. It is easy to disregard persistent nausea or indigestion as simply stomach problems. However, these symptoms may be a subtle sign of heart disease. In conditions such as atherosclerosis, the overall blood flow in the body decreases. Nausea may result from a disruption in the normal digestive processes that occurs when blood flow to the stomach and intestines is restricted. Ginger, which is traditionally used to treat nausea, may be able to help alleviate some of these symptoms. According to the findings of a number of different studies, ginger may also help lower cholesterol levels and improve lipid metabolism, both of which may contribute to a reduced likelihood of developing cardiovascular disease. 8. Cold sweats. When the heart is not functioning properly, such as during a heart attack or angina, the body may perceive a threat to its own survival. Because of this, the fight or flight response of the sympathetic nervous system is activated, which gets the body ready for action. The response of this system is to cause an increase in sweating as a means of bringing the body's temperature down. However, in extreme cases, such as a heart attack, this perspiration may be extremely heavy and icy, in contrast to the normal perspiration that occurs during exercise or when the body is exposed to high temperatures. In the early stages of heart failure, a sweat crisis may be an early sign of adaptation, or more accurately, cardiac maladaptation. However, a sweat crisis may also be a sign of the heart pumping too much in patients with acute coronary syndrome or cardiac arrhythmia. 9. High blood pressure, hypertension. When blood pressure is consistently elevated, the heart has to work harder to pump blood against the increased pressure. This may lead to an enlargement of the heart's muscular walls, which, over time, may weaken the heart muscle. In addition to that, high blood pressure may damage the inner lining of arteries, making them more susceptible to the buildup of fatty deposits called plaque. Over time, atherosclerosis may develop, reducing blood flow to the heart muscle and increasing the risk of coronary artery disease. Remember that having high blood pressure is one of the primary risk factors for having a stroke. Uncontrolled hypertension may damage blood vessels in the brain, leading to a hemorrhagic or ischemic stroke. According to a study, the attributable risk for BP, which is equal to or higher than 115/75 millimeters of mercury, was estimated to be 49% for coronary heart disease, CHD, and 62% for stroke. 1/3 of adults in the United States who have high blood pressure are unaware that they have the condition and are therefore not receiving treatment to bring their blood pressure under control. Because of this, getting your blood pressure checked on a regular basis, at least once a year, is highly recommended. What are the things that put your heart in danger? There are many things that may put your heart at risk for a variety of cardiovascular conditions, one of which is heart disease. The following are some important factors that contribute to risk. 1. High blood pressure, hypertension. Because hypertension does not typically present any noticeable symptoms, it is frequently referred to as the silent killer. However, it may significantly increase the risk of cardiovascular diseases such as heart disease and stroke. Monitoring your blood pressure on a consistent basis is extremely important to control this situation. 2. High cholesterol. Cholesterol is a fatty substance that is found in the blood. High levels of LDL cholesterol, low-density lipoprotein cholesterol, may lead to the buildup of plaque in the arteries, which makes the arteries less flexible and more prone to blockages. Excluding fats from your diet helps a lot in maintaining the cholesterol level. 3. Smoking. Tobacco use causes damage to blood vessels, lowers blood oxygen levels, and contributes to the narrowing of arteries, all of which increase the risk of developing coronary heart disease. Quitting smoking is one of the most effective ways to significantly reduce the risk of developing this condition. 4. Diabetes. Diabetes, particularly when it is not under control, may cause damage to blood vessels and nerves, which in turn increases the likelihood of complications related to the heart. Keeping a close eye on how much sugar you take in is not only important for controlling diabetes, but also for preventing heart disease. 5. Obesity. Extra weight places an additional strain on the heart, which may also contribute to the development of other risk factors like high blood pressure and diabetes. Exercise on a consistent basis is one of the best ways to maintain a healthy weight. In addition to this, it improves overall cardiovascular health and bolsters the heart's strength. 6. Poor diet. Long-term consumption of a diet high in saturated and trans fats, as well as an excessive amount of salt and sugar, has been linked to an increased risk of developing coronary heart disease. To achieve a healthy diet balance, it is highly recommended that you include leafy green vegetables, foods high in fiber, and an adequate amount of seasonal fruits for vitamins. 7. Genetics. It's possible that your genes have an impact on your heart health. If you have a family history of heart disease, it's essential to be proactive about monitoring your heart health. Rheumatoid arthritis and lupus are two examples of conditions that may have systemic effects on the body, including inflammation that may have an impact on the cardiovascular system. 8. Age. As individuals age, their risk of heart disease naturally increases. This highlights the significance of maintaining heart-healthy habits and scheduling routine checkups. The earlier in life you start practicing heart-healthy behaviors, the less likely you are to have problems with your cardiovascular system as you get older. 9. Stress. Chronic stress may have physical and emotional effects on the body, including unhealthy behaviors like overeating or smoking, which may contribute to heart disease. Having adequate sleep may help you manage your stress level. 10. Excessive alcohol consumption. While there is some evidence that drinking alcohol in moderation may have some positive effects on heart health, drinking in excess may lead to a variety of health problems, including heart disease. Next time you hit a bar, keep this in mind. If you are aware of the risks associated with heart disease, you will be better equipped to take preventative measures and fend off this formidable foe. These 9 early warning signs should not be ignored. However, it is extremely important to get medical help as soon as possible if any of these symptoms are experienced, whether by you or by someone you know. You may uphold a healthy lifestyle by eating a well-balanced diet, engaging in regular physical activity, and learning to effectively manage stress. Also, visits to your primary care physician at regular intervals may help monitor your heart health and identify any potential problems before they become more serious. You may significantly lower your risk of developing cardiovascular disease and live a longer, healthier life if you maintain vigilance and make decisions based on accurate information.